I think it's widely acknowledged now across the board and politically that long-term sickness is now one of the #1 challenges that we're facing as a country. And I imagine we'll all have seen the ONS statistics not very long ago published of 2.8 million people out of work now due to long-term sickness, up 600,000 from before the pandemic. And that has consequences, very wide-reaching consequences, and not only for the people involved, but also for social security spending and the growth of the economy. And there's no end in sight. And at our conference, Liz Kendall said, over the next 5 years, we're going to see 600,000 more people out of work due to long-term sickness. And the cost over the next parliament will be 33 billion extra because of the sickness and incapacity benefit. That's more than current day-to-day spending on defense. Of course, when people think about health, they probably don't think in the first instance about all the great work that you're doing in terms of health in the workplace. They think about the NHS. But times, as Suba has already said, have changed immeasurably since its launch in 1948. At that point, men could expect to live until they were 66, women until they were 70. Fast forward 75 years, we're now at an average life expectancy of 81.7 years. So it's a completely different ballgame. And of course, that's a wonderful achievement in many, many ways, but an aging society also leads to ever-increasing demands on the NHS, and I think your statistics show that very, very vividly. And it's not an issue we can simply throw more money at if you're the government, because the tax burden is already at its highest since the 1940s. But instead, we need to kind of get to a place where we pivot the whole health system away from what is essentially a sickness system to what is a true health system that really focuses on prevention. And to do that, there needs to be much more recognition of the enormous power of the workplace to create healthier lives. And Dana, from the previous panel, already talked about the enormous amount of time that people spend at work. It's 90,000 hours, I think, across a lifetime. But as a country, we're much less sophisticated than some of our European neighbors at using the potential of employers to drive workforce health improvement. And what struck us particularly is the Netherlands, which I'm sure you can correct me on, Roger. But our research shows that there was a threefold increase in disability benefit claims in the 80s to the early 2000s. And as a result, the government very dramatically overhauled the disability insurance system. Huge reform package, reconfiguring and strengthening sick pay requirements on employers. So alongside good sick pay, all workers are entitled to rehabilitation there, no matter what causes the health problem, and without any requirement to be recognized as disabled. And also, there's a legal requirement on employers to have occupational health services, and I understand it compulsory private health insurance too. So that's a very, very different situation, and also the tax environment is much better, unlike here in the UK, which you all know, and we know as well as insurers. And as a result, that's created a workplace health landscape with an emphasis on prevention, and it's yielded fantastic results. 60% drop in the number of people claiming disability benefits in the Netherlands. I mean, that's pretty drastic. We're very, very far away from that here. Now, in the UK, the government consulted on how to use policy in the tax system to support workers' health. So it was a joint consultation from the Treasury and the Department for Work and Pensions. And they rightly diagnosed the need for more employers to implement workplace health services, as well as a deficit in the occupational health workforce. And following the consultation, you may have seen this, the government last month set up the Occupational Health Task Force, led by Dame Carol Black, who's a bit of a rock star in this whole field. And that's tasked with producing a voluntary occupational health framework for employers this summer. And we, at the ABI, are a bit concerned about that because we're concerned about this focus on occupational health alone. Because even the government said, well, the capacity there is not sufficient to meet the demand. And we believe that actually what should be happening is there should be a recognition that the growth in employer-provided health services must be A, sustainable, but also there has to be choice, and that choice should include insurance, which of course all of you provide. I'm hopeful that Dame Carol Black and her panel of experts will take a more holistic view than just looking at occupational health on its own. Now, interestingly, the Work and Pensions Select Committee, the Select Committee that looks into the work of the DWP, recognized the benefits of health provision in the workplace through insurance. They said earlier this year that the DWP should look at how income protection insurance could work alongside occupational health to create a joined-up approach to workplace health. And I was very pleased to hear Liz Kendall say at our conference last week that we have to start looking at all these issues in a much more joined-up way with businesses and public services and with skills, and that actually the DWP can be quite a siloed department. So that will be, I think, very much a challenge for her, assuming that there might be a change in government, which doesn't look that unlikely, but I mean, everything's possible in politics, as we know. Now, as you all know, and as we would like to think, insurance already plays a crucial role in workplace health and in protecting UK labour supply. It's highly effective for prevention and for vocational rehabilitation, and we all know the reasons why. It's because there's a wonderful alignment of economic interests between the individual, between you as employers, and between the insurers. If people can get helped to get back to work quickly, if illnesses can be prevented, then that means that the costs are going to be so much lower, and that's the cost right across the piece. We have the data, we collected them for the first time last year, that shows just how incredibly well it works. We looked at over 16,000 vocational rehabilitation cases from 2021. And we found that 9 in 10 people who used vocational rehabilitation through group income protection were supported to stay in work or return to work after an absence. 42% of those came back in less than 4 weeks, 81% of those in less than 6 months. And we then looked at, well, what does that actually mean in the aggregate? So that means that these are great figures on the back of these statistics that we had. What does it mean in the aggregate? What does it mean for the economy? And we found that the use of health services through insurance increases the labour supply by 12,500 full-time equivalent workers because fewer people leave their job. And what's more, it prevented 14 million days of long-term sickness absence. That is quite a lot, 14 million days of long-term sickness absence. And in terms of the economic benefits it generates, the WPI Economics estimated that it generates 6.1 billion in financial benefits across businesses, the wider economy, and the exchequer. So it's clear we have the tools to respond to the UK's working age sickness crisis. We just need to persuade the government to think a bit out of the box, I think. And international evidence supports the central role of employers, but also that employers must be incentivized and supported to provide health and return to work services. It needs a culture shift, as already has been said, and also robust government nudges. And in that respect, given how successful more generous sick pay systems are, we believe that statutory sick pay should be increased to create an incentive for businesses to invest in the health of their employees. And you may have seen this in the Labour New Deal for working people that they brought out at the beginning of the year. They had a commitment in it just to raise statutory sick pay and to make it available to all workers, including people on low wages currently excluded by the lower earnings limit. And we were pleased to see this because we believe it's the right behavioral nudge to get employers to focus much more on the health of their workforce. To be clear, I don't mean you, because you already do all of this stuff, but it's just not across the economy. And I think that we need to change that because the majority of people work in SMEs. So it's a totally different ballgame from what many of you international organizations, global organizations can provide. And if you'd like to support our call for a better tax environment, please have a look at our campaign to cut insurance premium tax, which you all pay on health insurance in the UK. You may already have seen it. It involves a rather quirky dancing pair of scissors. And the scissors are called Snippy. Please like it on social media.